Welcome back to Afternoon Live. Our next guest has 5 skin hacks you could do at home to cancel COVID face. We welcome dermatologist Dr. Dusan Sajic is with us today. Dusan, great to have you on the show.
Thank you so much for having me on the show. And yes, absolutely. It's time to flip the script and actually go back on COVID and cancel COVID for a second, or at least COVID face.
At least COVID face. I like it. And you have these 5 skin hacks, which I love these, actually, looking at. I've never heard some of them. First of all, talk about how to avoid maskne.
Yeah, it's a key component. I think we're seeing a lot of it. It's a term we call really for what we've seen before. It's really occlusional acne. So anytime you have any kind of occlusion, that's really key. So one of the key things is you want to make sure you're wearing a mask if you can, that's cotton-based, and then really washing it, considering like underwear. You're going to change it frequently. And then one of the things that's actually not really, even though it's called maskne, it sounds like acne, it's really not acne. It's a different process. So some of the products we're using for acne is actually going to make it worse, like retinols, salicylic acid peels, other chemical peels, benzoyl peroxide. So it's really about changing what we're using. That will be one major hack for that.
Well, I have not heard that. It's actually not the normal acne. Now, so cotton masks are better than just the disposable blue ones that you see?
Well, it's all about the irritation. So the disposable blue ones, that's harsh material that's actually going to be scratching and causing a lot more moisture and condensation. And that's really the primary driver. It's going to break down that epithelial barrier, the protective skin that we have there, and really disrupt the protective microbiome. So that we have a bunch of bacteria that live on our skin and actually protect our skin. And when you have a lot of moisture, it really changes all of that. And that's why I think getting a cotton mask, preferentially with 3 layers, so you're still protected from COVID, will be the key to helping minimize maskne.
And then simplify your routine.
Absolutely. We see that a lot. It's also another term we call acne cosmetica, and we saw it even before COVID, and that's when patients put on too many products, too many essential oils, and they're really trying to have this 20 regimen routine where I say, you know what, we can simplify that. You don't need a lot. Just wash your face, even with lukewarm water, a gentle cleanser, and then maybe a gentler routine now. So instead of retinol, there's a vegan alternative that I think you're going to be hearing a lot more about called bakuchiol, and we've been fortunate to do some studies on that and seeing, in addition to our other peers and colleagues that do research, that it has many of the major benefits like preventing acne, blemishes, even acne scarring, a recent study that we did, and also just aging in general. So switching to a more gentler formulation would be also key.
What's that alternative? What's the name of it again?
So you'll be hearing a lot, bakuchiol. So that's, okay. You're going to be hearing a lot about it. So look for products that have it in their system.
Okay, this is crazy to me. You say that studies show that blue computer light ages us faster?
Absolutely. So that's kind of, the sun damage is number 1. And I always say I have the 3 pillars of dermatology. So it's sunscreen, actually number 1. And then we have retinol, which we sort of want to use minimally now because of this acne and stuff, maskne. And so blue light, we've actually found out that if we're looking at it, it's actually going to do some of the same damage that the sun can do and actually age us faster. So I call it Zoom face, or COVID. Part of the COVID is the Zoom face. So we see ourselves, we look a lot harsher on TV than we do in real life. And then again, this blue screen. So you can put filters on, you can use tinted sunscreen even while you're doing Zoom so that you're protected.
So the sunscreen helps with that blue light?
Absolutely. Sunscreen, or even putting a filter. So a lot of Apple has it, Samsung, all of the Android devices have it. You can actually put it on, it's called night mode. And so it actually gets rid of that blue. That's the light that's going to be damaging to our skin and to our eyes, make it harder to sleep at night. So by blocking that out or putting on an actual filter, like Gorilla Glass with this filter, that can help a lot as well.
You say to avoid toners as well.
Yeah, absolutely. And this, especially in this day and age, even now, even before COVID, I think toner was overkill. It's really stripping the face, stripping the natural protective barrier, finding that we really got to take care of our skin. So by going and really damaging it with toners, I think most of us dermatologists are going away from toners in general. And now, especially with maskne and masks causing that stripping and moisture and wicking in the skin, adding toners, I think I would definitely stay away from.
You talk about alternative skin treatments. I know you talked about the vegan retinol alternative, but what are these other 2? There's an antioxidant and an anti-inflammatory compound?
Yeah, you heard JLo talking a little bit about it with olive oil. So she's gotten a little bit of flack as maybe it's not all olive oil that's causing her to have beautiful skin. Certainly genetics and probably other treatments might be contributing. Who knows? She's keeping it very secret. But there's a component in it called hydroxytyrosol that you're going to be also hearing a lot more about as a research dermatologist doing clinical trials. We're really scouring the information and trying to keep our patients up to date as much as possible. And that's an ingredient I think you'll hear a lot more about. So stay tuned. I think a lot more research. As far as an antioxidant, that's one of the things I like to say in my skincare routine. And vitamin C's got the most data, but hydroxytyrosol actually is about 10 to 100 times more potent than vitamin C as being an antioxidant and much more less irritating. So I think that's something you'll hear more and more about.
Thank you so much. Okay, I'm going to have to link all this because you hear the vitamin C, the retinol all the time. And now you're using big words to replace them that I know people are going to want to know about. Thank you so much, doctor. Appreciate it.
Absolutely. Thanks for having me.
Great tips. We'll have more information about today's segment and about Dr. Sajic on Sajic on our website at katcu.com. Don't go anywhere. Afternoon Live will be right back.